right, so today I'm doing a series of videos for beginning of the year about just the process of getting into the surgery and evaluation. So earlier I spoke about how to make a consultation. Let's say we had our consultation. We decided which surgery we're gonna do. Let's say we needed a tummy tuck and the weight is good, we're not overweight. We decided that you're a good candidate. It's time to plan the surgery. Time for surgery, how do we decide? Well, many different reasons to do different timing for surgery. So a lot depends on you. After your initial consultation, obviously different people would do consultation different times. Some people do it way ahead of time. They want to plan 1 year in advance, 2 years in advance, which I think 2 years is a little excessive. So many things change during that time. Let's say you're doing initial kind of preliminary consultation 1 year in advance. Then, it's easy to schedule surgery because most of our surgeons don't book out that far out. In my practice, some people look at their schedule. For example, teachers, people who work for school systems, they usually prefer to do it right around the break time so they have enough time off while kids are out of school. Summertime is busy for surgery for school teachers, or Christmas time or spring and fall breaks, because that gives them enough time to recover from surgery. So people will schedule around their vacation time. Others will have to see who will take care of them, who will help them during recovery time. Tummy tuck needs, a good week of hard recovery, let's say. You will need somebody around the house helping you with kids, maybe driving them to school, maybe helping you cook for them. They're obviously older, it's different. So you have to look at your personal situation to decide what will work for you, when your significant other or your family member will have time to take off work or come down and visit you so they can help you. So many different family situations out there right now. So that's another big factor to consider while you're scheduling for surgery. Or another factor is, when do I have available time? Right now I'm scheduling about 6 to 8 weeks ahead. So even if you come in today and said, I want surgery now, I'll say, sure, we will put you on the schedule for sometime in the February. That's the only time I have available. I only have 2 arms and only so many hours in a day. Time is limited in the operating room on how many cases I can do. The one doing all of my surgeries, unlike some places that you see in some towns that I'm not going to name, or outside of the country, where patients describe places where you come in and there's like 20 people getting surgery from this one doctor today. Technically, physically impossible to do that. That means somebody else doing surgery. In my practice, it's the surgeon who does the surgery, me. So I only can do 2, 3, maximum 4 cases in a day, depends on time of each case. So tummy tuck with liposuction is about 4-hour case. I can only do 2 a day. I cannot do 20. So that will obviously stretch the time out to when the next surgery can be placed on the schedule. For some patients, we need to lose some weight ahead of time. So it depends on the route we choose for the weight loss. If we decide to do surgery for weight loss, a bariatric gastric sleeve surgery, we're going to wait at least 6 months after that surgery in order to do any cosmetic operations, most likely. If we're doing some pills or shots or other nutritional program, just depends on you. Depends how fast we're going to get that weight off to get to our goal weight to be able to get the cosmetic surgery we need. So many different possibilities. Best thing is to come into the office, obviously do a consultation, go through that process of, okay, how much time off will I need? Look at your family situation, look at your work situation, decide what's going to be good timing for you, and then we can go from there. So don't panic before the consultation. As I said before, consultations are easy. They're made to make your life a little easier, hopefully give you enough information to make a good decision. And then once you do that, we can help you actually find out time to surgery based on your personal situation. But usually plan for at least several weeks ahead, because most of the time we cannot get you on the schedule within a few days, right? We have to usually look at least next month. Hopefully that answers some of your questions that you've been asking. Thank you.